Hi, I'm Dr. Josh Vance with Komizo Diagnostics. So the case of today is that we had somebody that was shifted in an antalgic position to the right-hand side, like this picture here. You can see on this one that she has more space on her elbow to waistline. This was a young man who came in deviated to that position in a lot of pain. His pain was more on the left side than the right side. And so from a standpoint is, we went through and figured out that his iliocostalis muscle group, which runs along the lateral edge of the center of the spine, one side was contracting and spasming, the other side was being pulled in that position. So one of the things that we put together with Komizo is to educate the patient on a relief position that they can lay in at home. So in this case, in this young man's case, he was shifted to the right-hand side. So we started to give him a relief position that would force his spine going to the left. So what I did is I taught him with this here by printing out on his case, on laying in bed with pillows underneath his armpit to shift his spine to the opposite side. So we're shifting to the mirror image position. Or he could lay on a hard surface and deviate him here to the left-hand side. Both of those cause the spine to go the same way. So what I did is I just had him do this at home. I did it in the office for about 5 minutes. He immediately got up and noticed that he had tremendous relief just from that position without doing any other therapy. So I prescribed that for him to do this about 5 to 10 minutes a day, or 5 to 10 minutes of a dose 2 to 3 times a day. And I have him laying in his bed in this position to do this. And we've done this before, and typically they get tremendous results within just a couple of days, getting them out of the acute phase of their pain in that translation. The biggest concern is that when they're translated like that, they're putting a tremendous amount of pressure on the disc, too much, and that oftentimes can cause a lot of other neural symptoms. But it also causes a radiation of symptoms into the opposite side of the lean because the iliocostalis muscle is pulled too tight, and it'll also refer down the leg itself and give some sort of sciatic referral pattern that seems like. We see about 70% of cases when they are leaning like this, the 70% of them have the pain on the opposite side or into the opposite leg. So this one was very successful. I hope you learned something. Thanks for tuning in.